Today's bump date is for week 12. Week 12, the nausea and vomiting did continue. They were not letting up at all. Also, the tenderness that I had been feeling in my breast had definitely returned to the point basically where I didn't want to wear a bra because it was so painful. My skin was very dry and flaky, and I even noticed, my nipples were very dry, and no amount of lotion has really been able to help that situation out yet. I also had a decrease in the amount of discharge that was flowing out of me, and I was very, very dizzy in week 12. So much so that I would almost pass out if I stood up too quickly or if I moved fast. So I kind of had to, take it very slowly, sit up slowly, walk around slowly, all that stuff. As far as my weight, in week 12, I was actually down half a pound from my pre-pregnancy weight. So I was down to 101 pounds, which was probably due to the amount of vomiting that I did in week 12. In week 12, we also went to have the NT scan, which came back at a very low risk for having any abnormalities. Of course, you never know, something could happen, but the skin fold or whatever in the back of the neck was very small, and the spine looked good, everything looked fine there. We also, in week 12, joined a study that the University of Colorado Hospital is doing on high-risk pregnancies and the effect of stress, high-risk pregnancy and the effects of stress on fetal brain development. So basically they are trying to measure how much stress impacts the baby's brain. So what they've done is they took my blood, they took a very thin strand of hair, or like a seam of hair from my head, and they'll be doing extra ultrasounds and whatnot on me. They also took a DNA sample for my husband to rule, to see what genetics plays in brain development and things like that. And then when the baby's born, they'll take some of the baby's blood. They said they usually use the cord blood if that's available. If not, they'll just take a little tiny bit from the baby. They'll also do an MRI on the baby at about 6 weeks, I think, and they'll take a little bit of the baby's hair, and they'll do a sleep study on the baby and something else. Oh, they'll do a stress test where they basically just kind of make a little bit of loud noise, and then judge the baby's reaction to the loud noise. So all of it is really non-invasive, and will tell them a whole lot, hopefully. The last thing that happened in week 12 is that I started to be able to feel the baby move. And I know, like, everybody says 12 weeks is way too early. You can't feel a baby at 12 weeks. But considering the fact that from hip bone to hip bone I'm only 12 inches wide, and from the back of my hip to the top of my abdomen is only 5 inches deep, there's a little baby in there that's growing, and I could definitely feel little movements. And to me it felt like if you were to place some marbles in a sock and then kind of do like this with your hands, you can kind of feel the marbles. That's kind of what it felt like to me. It didn't feel like gas or butterflies or anything like that. It felt like marbles in a sock. So here is my bump photo for 12 weeks. And Thanks for watching. I will talk to you guys shortly for my 13-week video. Bye.